The Department of Medical Assistance Services would like to welcome you to the Consumer-Directed Services Attendant Training. Our goal is to provide resources needed to perform personal care services to Medicaid members. Although this is an attendant training, we encourage each employer of record, or EOR, to take this training in order to better support employees in their role as personal care attendants. Today we will discuss Consumer-Directed or CD Services overviews, CD roles and responsibilities, Electronic Visit Verification or EVV, Abuse, Neglect, and Exploitation information, Fraud, Waste, and Abuse information, Culturally Competent Care, Paid Sick Leave Benefit, CD resources, and we will also answer any questions related to this training. Medicaid waiver benefits include consumer-directed services. Waiver programs and services include developmental disability waivers, Commonwealth Coordinated Care or CCC Plus waiver, the Early and Periodic Screening, Diagnostic, and Treatment Program, and Medicaid Works. Additional waiver and program information may be found on the DMAS website. There are 3 available services in the CD program. Attendant care, also referred to as personal care or personal assistance, which helps individuals with their activities of daily living or ADLs. They may also support individuals with their ADLs at work and other places in their community. Respite care provides support to individuals that provide relief to the unpaid primary caregiver. A respite attendant may assist the individual at home and in the community. Please note, CD attendants may not perform skilled respite services. Skilled respite can only be provided by a registered nurse or a licensed practical nurse. Companion care assists individuals with tasks like light housekeeping, shopping, and community activities. This is only available in the Community Living and Family and Individual Supports waiver. Here are some frequently used CD terms. Employer of record, the person who performs the function of the employer in CD services. The EOR may be the individual receiving the services or another person designated by the individual. Individual or member. This person is receiving Medicaid waiver services and support. Personal care attendant. The person hired to provide consumer-directed care or supports. Services facilitator. The provider that is responsible for assisting the individual or EOR with the employer packet, hiring of an attendant, and coordination of other CD-related services. Fiscal employer agent. This is the contractor that handles attendant payments for CD services on behalf of the EOR. Currently, there are 3 FEA contractors for CD services. Let's discuss some CD roles and responsibilities. Each individual receiving CD services must have an EOR, or employer of record. The EOR may be the Medicaid member or a designated representative. One common question asked by attendants is, who is my employer, or who is my employer of record? The employer is the person who oversees daily responsibilities of the personal care attendant. The employer of record is considered the employer of the attendants providing care and supports for the individual. They must be at least 18 years old. Please note, DMAS, the service facilitator, and the FEA do not employ the attendants. The EOR employs the attendants. Duties of the EOR include: they hire, train, supervise, and dismiss employees. They schedule work hours for the attendant and ensure attendants only work approved hours. They ensure attendants clock in and out for each shift worked using an approved electronic visit verification method. They approve work shifts. If you have questions about hours or training, your EOR is your best resource. Let's discuss your role as a personal care attendant. The personal care attendant is the individual who provides CD personal care, respite, or companion supports for the waiver individual. The attendant must have the skills to perform services specified in the member's plan of care. This document is called a plan of care. It may also be referred to as a service plan. It details activities performed by the attendant to provide care to the member. Please note, a copy of the plan of care or service plan must always be in the home. Each personal care attendant and EOR sign an employment agreement when they enroll with the fiscal employer agent. The following information is included in this agreement. An attendant may not be the spouse of the individual receiving services. They may not be the parent of a minor child receiving services, and they may not be the designated EOR directing the care for the individual receiving services. Please note, as a part of current COVID-19 flexibilities, parents and spouses are temporarily allowed to be paid personal care attendants. Here are some key points to know about the provider that assists the EOR. The Services Facilitator, or SF, developed the service plan with the member and the EOR. They provide the appropriate FEA forms to start the EOR process. They submit service authorization requests. They train the EOR on required employer tasks. They document services required by DMAS. They assist the EOR with FEA paperwork. Each EOR member and attendant must be enrolled with a CD FEA. Managed care members use CDCN, PPL, or Access based on the member's MCO enrollment. Fee-for-service members use CDCN as their FEA. The FEA, or Fiscal Employer Agent, performs payroll activities on behalf of the EOR. The role of the FEA is to process EOR and attendant enrollment packets, manage attendant employment and tax documents, ensure paychecks for eligible payroll and sick leave hours are submitted, complete criminal and central registry background checks, and issue W-2 statements. The fiscal agent pays attendance on behalf of the member. The EOR is the employer. DMAS implemented a federal requirement known as Electronic Visit Verification, or EVV. What is EVV? EVV is a technology-based system that electronically captures details of services provided by the attendant. It also ensures members are receiving the support they require and services are billed accurately. Each fiscal agent has a process to access their EVV mobile application. Attendants must use an approved EVV method, and examples of these methods are FEA mobile applications, an interactive voice response IVR system for those in areas with limited cell phone services. Attendants are required to clock in prior to starting a shift and clock out at the end of each shift. Attendants may use the web portal to clock in and out when they are a live-in attendant or when adjusting an EVV entry. For additional questions about EVV, please contact your FEA or visit their website. Abuse, neglect, and exploitation. Let's talk about mandated reporting. CD attendants are mandated reporters. The purpose of mandated reporting is to identify suspected abuse and neglected children or vulnerable adults as soon as possible so that they can be protected from further harm. If an attendant suspects or knows of any abuse, neglect, or exploitation, they must report it to the proper authorities. The Department of Aging and Rehabilitative Services and the Department of Social Services investigate all reports of adult or elder and child abuse, neglect, and exploitation. These websites provide important information about their role in collecting, reviewing, and taking action in reported and suspected Adult Protective Services, or APS, and Child Protective Services, or CPS, cases. Attendants are encouraged to visit these websites and take the trainings to learn more about their role as mandated reporters. Let's talk about fraud, waste, and abuse. Fraud means an intentional deception or misrepresentation with knowledge that the information is false. For example, an attendant works a total of 6 hours on Tuesday, but submits 9 hours to be paid. This is fraud. Never submit hours that have not been worked. Waste means inappropriate utilization of services or misuse of resources. For example, a person using a member's Medicaid purchased supplies for someone other than that member. Abuse means to treat a person with cruelty or violence, especially regularly or repeatedly, excessive or improper use of services. An example of this is someone threatening to harm a member if they do not approve a fraudulent shift for payment. All of these instances should be reported immediately. CDCN has provided this fraud prevention resource you may find helpful. This is just one example of a resource. Please feel free to contact your employer or fiscal agent to discuss information about their fraud process. Fraud prevention is the responsibility of everyone in the CD program. You can find the fraud prevention video and resources at the link provided. Let's discuss culturally competent care. What is culturally competent care? This is the ability to recognize and respect diverse values, beliefs, behaviors, and linguistic needs. Culture, language, and member abilities are all a part of this care. We must remember to use person-first terms. For example, it is better to say a person that uses a wheelchair rather than a wheelchair bound. This shows that you see a member as an individual. It also emphasizes the individuality, equality, and dignity of the person with a disability. We must respect preferences. If a member asks that you use specific language concerning them, use it. Always use member communication preferences once they have been shared. Be patient. Sometimes it may take the member a little longer to communicate with you. Try to not interrupt them or finish their sentence. Use the pace they set. Exercising patience when talking with your member ensures they feel seen and it ensures you heard what they had to say. It is important to understand the differences that exist between caregivers and people of different ages, cultures, and viewpoints. Being aware of these differences help attendants provide the best care for their members. Some people make assumptions based on appearance, accents, and/or other personal characteristics. This is called unconscious bias. When we make assumptions based on what we see or what we think we know, we have the potential to become ineffective in caring for the member. If you identify that you have any assumptions, work to eliminate them by communicating with the member or the member's advocate. There are several benefits to culturally competent care. Members will feel more empowered and supported. It also helps the attendant demonstrate empathy. This method of care may help you recognize potential or existing issues. Enhanced communication, increased member safety, and improved satisfaction and trust may also lead to improved health for the member and efficiency for the attendant. We will now review the paid sick leave training for personal care attendants. House Bill 2137 was passed by the 2021 Virginia General Assembly and requires eligible consumer-directed attendants to be provided with paid sick leave. Sick leave is available for eligible consumer-directed attendants that work an average of 20 hours per week or 90 hours per month. This includes all consumer-directed services. What is a quarter? A quarter is a grouping of 3 months. There are 4 quarters in every year. This timeline provides the schedule for the sick leave eligibility period. We will talk more about this schedule later in the presentation. Some attendants work for more than one employer of record. Determining eligibility for sick leave is based on the number of hours worked for each EOR during a quarter. These hours are assessed separately and will not be combined. There are 2 ways to determine if the number of hours worked meet the minimum requirements to qualify for sick leave. Pathway 1, an individual will qualify for sick leave if they work an average of 20 hours a week for all 3 months in any quarter. Or Pathway 2, an individual will qualify for sick leave if they work at least 90 hours per month for all 3 months in any quarter. Each FEA will need adequate time to complete their sick leave eligibility assessments for each attendant. This is why all time worked must be submitted and paid by the 20th day of the month following the end of the quarter. Assessments will begin promptly on the 21st day to give each FEA time to process all payroll from the previous quarter. At the end of each quarter, The payroll vendors will conduct an assessment of the hours worked by the attendants to determine who is eligible to earn sick leave. It is important that attendants and EORs submit these shifts timely. Please note, eligibility calculation begins on the 21st day after the quarter ends. Here are some key assessment points. If an attendant does not meet the initial sick leave eligibility in the first quarter, the FEA will reassess them each quarter to determine if they meet eligibility. Once an attendant meets the eligibility criteria for sick leave, they remain eligible until the end of the current fiscal year, which is July 1st through June 30th. They will not be reassessed until the next fiscal year. How are sick leave hours earned? All consumer-directed fiscal employer agents will determine the number of awarded sick leave hours. Fiscal agents will track these hours to ensure eligibility. Fiscal employer agents determine the initial number of sick leave hours earned after an individual becomes eligible for sick leave. Eligible attendants earn 1 hour of sick leave for every 30 hours worked during the qualified quarter. Accrual of sick leave is retroactive to the start of the qualifying quarter. After eligibility is established, accrual will occur every pay period. Earned sick leave hours are available to use the first day of the second month following the end of the qualifying quarter. Eligible attendants with qualifying hours that meet the minimum hours worked requirement will earn 1 hour of sick leave for every 30 accumulated hours worked in the quarter. For example, an attendant that worked 90 hours will earn 3 hours of sick leave. An attendant that worked 300 hours will earn 10 hours of sick leave. Let's demonstrate a retroactive awarding of sick leave hours. During the third quarter, which is January 1st to March 31st, an attendant worked a total of 330 qualifying hours. The attendant's sick leave accrual is calculated from January 1st through March 31st. The attendant's eligibility is determined in April, which is the month after the end of the quarter. The attendant has earned 11 sick leave hours. They may also use the sick leave hours as early as May 1st. This is the beginning of the second month after the quarter ends. Here is a sick leave accrual example. During the second quarter, October 1st through December 31st, the attendant worked a total of 320 hours and qualified to earn sick leave. The attendant's sick leave accrual will start from October 1st and be calculated through December 31st. This attendant will have 10 hours of sick leave available starting February 1st. We will discuss the details of how hours are calculated later in this presentation. Here's another accrual example. During the third quarter, January 1st through March 31st, the attendant worked a total of 266 hours and qualifies to earn sick leave. On May 1st, the attendant will receive 8 hours of sick leave. This chart shows the reimbursement cutoff for hours worked as well as the date earned sick leave is available for each quarter. Please note, all time entries for a quarter must be submitted and paid by the 20th day after the quarter ends. For example, quarter 3 is from January 1st through March 31st. Any time for this quarter submitted and paid after the reimbursement cutoff date of April 20th will not be included in the FEA sick leave eligibility calculation. The following process is outlined to provide guidance for receiving payment for earned sick leave hours. Following these guidelines will help to ensure appropriate sick leave eligibility in our calculations. Attendance work hours are submitted to the EOR each week. The EOR submits approved hours to the fiscal agent every 2 weeks. Late submissions will affect the attendant's eligibility for sick leave and may make the attendant ineligible. The FEA processes payroll and provides reimbursement. Approved and submitted hours worked must be received by the 20th day of the month after the quarter ends in order to be included in the eligibility determination assessment process. For example, all hours worked in July, August, and September must be received by October 20th to be included in the sick leave calculation for quarter 1. The FEA will begin sick leave calculations on the 21st day after the quarter ends. Sick leave hours are available for use on the first day of the second month following the end of the quarter. Sick leave will then accrue at the end of each pay period going forward. When may an individual use their sick leave hours? House Bill 2137 provides specific guidance detailing the purpose for sick leave usage. An attendant may take leave for themselves or for a family member like their child, parent, spouse, etc. Here are some important sick leave hour notes. Sick leave hours may be used in 15-minute increments. For an example, an attendant may use 30 minutes of sick leave time instead of having to use a full hour. Sick leave must be submitted within 30 days of using it. Timely submission will ensure the FEAs have adequate time to calculate and deduct used sick time from an attendant's accrual balance. This ensures all system reporting available to the EOR is accurate. Attendants may earn and use up to 40 sick leave hours in a fiscal year. This means that regardless of the number of qualifying hours worked, an attendant may not accrue more than 40 hours per fiscal year. Let's discuss carryover for sick leave hours. An individual may use up to 40 hours of earned sick leave per fiscal year. Any unused sick leave hours at the end of the fiscal year will be carried over into the following fiscal year. Please note, no more than 40 hours of sick leave may be used in a fiscal year, including when an individual has accumulated a bank of more than 40 sick leave hours through carryover. This is an example of how sick leave hours may carry over into the following state fiscal year, or SFY. This attendant has earned the maximum 40 sick leave hours for the fiscal year that ends June 30th. During the year, they use 30 of those hours, leaving a remaining 10 sick leave hours. These hours will carry over at the start of the new state fiscal year that begins July 1st. The attendant may now earn up to 40 additional sick leave hours in the new fiscal year. Here are some responsibilities for the fiscal employer agents. EORs have an important role in sick leave benefit management. It is recommended that the EOR review sick leave expectations with their attendant prior to November 1st, 2021, or upon hire. Here are some key points. Attendants are responsible for notifying the EOR of sick leave requests prior to using the hours. This allows EORs an opportunity to contact another attendant to work the shift. The EOR may ask the attendant to submit the request for sick leave verbally, in writing, electronically, or by any other means agreed upon between the EOR and attendant. This process is identified during the hiring process. When possible, the attendant shares with the EOR the total amount of anticipated time to be used for sick leave. For example, an attendant may make a request to the employer if they expect the usage of sick leave to last for a specific amount of time, such as 12 hours or 2 days. Here are some EOR key points. When an attendant uses 3 or more consecutive days of sick leave, the EOR may require documentation demonstrating that the paid sick leave was used appropriately. Attendants are not required to find shift coverage when using sick leave. Attendants are not required to work alternate shifts or to make up work hours for sick leave use. EORs track and approve all eligible sick leave hour requests for their attendants. EORs may not retaliate against an attendant for using sick leave. The EOR may not terminate, discipline, threaten, discriminate against, or penalize an attendant because the attendant requests or uses their sick leave. Sick leave will not be paid upon termination. If an attendant has a sick leave balance on the day of termination, the balance will not be available to the attendant. Here are some frequently asked questions attendants may have regarding paid sick leave. Fiscal employer agents will provide additional frequently asked questions or FAQs for your convenience. Here are some consumer-directed or CD resources you may find helpful. Where can attendants find answers to questions like, why didn't I get paid this week? How can I get information about attendant applications? What is my EVV login? Where can I get an employment verification? Your fiscal agent can answer all of these and more. Here are some websites and contact information for each FEA. This is where attendants can find more information on sick leave, EVV, enrollment, payroll, and more. Please work with your employer to determine which FEA to contact. All Fiscal employer agents provided additional sick leave training and continue to do so. They have forms and other resources available on their websites. Some personal care attendants may be eligible to enroll in Medicaid. For more information and to find out if you qualify, please visit the Cover Virginia website below. Here are some smartphone resources that may be helpful for EVV submission. Each program has its own criteria. EORs or members may contact these vendors to inquire about them. Some managed care organizations provide smartphones as a benefit for Medicaid members. Each MCO may provide their member with additional information about this resource. For additional assistance related to this training, please use the resources below. The Department of Medical Assisted Services website, the DMAS Consumer Directed Employer Record Manual, the Department of Medical Assistance Services CD Attendant Help email box. Thank you for listening to this training. We certainly heard a lot of information today. If there are any additional questions, please feel free to contact us at cdattendantinfo@dmas.virginia.gov. That email address, again, is cdattendantinfo@dmas.virginia.gov. Thank you for your continued work with DMAS Medicaid members.